Hello, everyone. Thanks for attending this presentation today. I'm Dr. Karen Woodall. I'm an assistant professor at the University of Toronto. I work in the forensic science department there, and I'm a forensic toxicologist. And prior to joining the University of Toronto, I worked for 20 years at the provincial forensic laboratory in the toxicology department. So today I'm going to be talking about the opioid crisis and giving the forensic toxicologist perspective. So I do know that there are a number of different people attending this presentation with different backgrounds. So I'm going to start off by giving a bit of overview about opioids. So opioids are drugs that work on opioid receptors in the body. So originally, opioids were natural substances. For example, they all arise from the opium poppy. And in the 1800s, morphine was first extracted from the opium poppy. And that was a major milestone in pharmacology. It was the first time the active ingredient of a medicinal plant was isolated. And morphine was named after the Roman god of dreams, Morpheus, and that was due to the known effects of morphine at the time, which was based on its sleep-inducing and sedative properties. So we know that opioids are widely used medications. They're very good for pain relief, so they're widely used for analgesia. However, we also know that issues occur to the high potential for abuse. We know that opioids can cause euphoria, which is one of the major reasons why they can be abused. And there's also addiction issues. So opioids can be addictive, and opioids also can be very toxic. One of the main mechanisms of toxicity for opioids is respiratory depression, which sometimes can even lead to death. There's a number of different types of opioids. So as I mentioned, traditionally opioids arose from the opium poppy, and the naturally occurring opioids are all chemicals that do arise from that natural plant. So examples of these naturally occurring opioids are morphine and codeine. There's also semi-synthetic opioids. So these are substances that are chemically related to the naturally occurring opioids, but they've been slightly altered. Examples of these would be hydromorphone and oxycodone. And then another type of opioid are known as synthetic opioids. Now, these still act on opioid receptors in the body. However, chemically, they have entirely different chemical structures. So they're chemically unrelated to the naturally occurring opioids, but they still act on the same receptors. Which brings me to what is the opioid crisis. So the opioid crisis is the issue that has arisen based on the use of opioids and the increase in deaths and hospitalizations that have arisen based on opioid misuse. 3 waves have been identified. So the first one began in the 1990s and was related to the use of prescription opioids. An example of that would be the widespread use of oxycodone. And back in the 1990s, it was believed that use of these prescription opioids were not going to cause addiction problems. However, that did not turn out to be the case. And we saw an increase in abuse, an increase in overdoses, and also an increase in deaths. The second wave occurred in around 2010, and this was an increase in the occurrence of heroin overdoses and deaths. And one of the issues occurs when people can become addicted to opioids. If they can no longer get prescription opioids, then some individuals will turn to other sources to find their opioids. And then the third wave relates to the use of synthetic opioids, mainly the use of fentanyl and compounds related to fentanyl, known as fentanyl analogues. And then interestingly, recently, some researchers have started to identify what's been described as a possible fourth wave of the opioid crisis, and this involves polysubstance abuse. So this is the use of opioids and other drugs, usually stimulant drugs. Methamphetamine and cocaine are the two most common stimulants that have been identified as being part of this fourth wave. So this graph comes from Ontario in Canada. This is where I work. The province of Ontario has a population of just under 15 million. So the data that comes from Ontario is useful for monitoring trends in drug use. This information comes from Ontario Public Health, and they use information about opioids that have been detected in death investigations, and they publish this information on the internet, and it's available for anybody to access. You can see from this graph quite clearly the issue of fentanyl, and so this relates to the third wave of the opioid epidemic. And before 2015, there weren't that many fentanyl-related deaths in the province of Ontario, but since that time, the number of deaths that occur where fentanyl has been detected has increased every single year. And you can see that the last year where the data is available, so that's 2020, there were over 2,000 deaths where fentanyl was present at death. You find that these drug trends are also seen in the US. So Canada and the US, often you definitely see similar trends in drug use, and that is the same for the opioid epidemic. So for example, in around 73% of all opioid-involved deaths in 2019 were synthetic opioids. This data comes from the CDC. In 2019, so that accounts for about 36,000 deaths that all involved synthetic opioids. Interestingly, this data also shows that the fentanyl, which is the main drug that's seen in these deaths, it's more likely to be from illicitly manufactured fentanyl compared to pharmaceutical fentanyl. And this shows that the shift that's occurred in the opioid crisis. If you remember, the first wave mainly involved prescription opioids, but now the shift has definitely changed to more illicit opioids. So what's the role of a forensic toxicologist? So a forensic toxicologist plays a very important role in the opioid crisis, because the role of a forensic toxicologist and toxicology labs is going to be looking for drugs, so the different opioids in various cases. So for example, in death investigations, which opioids are present. You will also want to know kind of how much drug is present, so you can interpret the findings. So not every opioid detected at death means that it contributed to the death, and a toxicologist can assist with that kind of interpretation. Is it a concentration high enough to cause death, for example? Toxicologists can help by doing research into the toxicity of opioids, and then collaboration between toxicology laboratories with law enforcement, death investigators, so including coroners, medical examiners and also public health officials can be very important. So I mentioned the significance of fentanyl in the third wave of the opioid crisis. So I'm just going to do a little bit of an overview on fentanyl and one of the major fentanyl analogues that's seen in forensic casework. So fentanyl is a fast-acting synthetic opioid. It's a very strong drug. So it's 100 times stronger than morphine. And morphine itself is a very powerful opioid drug. It's used clinically to pre-medicate prior to surgery. It's also available via prescription. So people suffering from chronic pain conditions may be prescribed fentanyl pain patches. These are patches that can be worn on the skin to give constant pain relief for up to 3 days at a time. And then fentanyl is available like during hospital treatment, and it's usually in the form of an injectable liquid. I did mention, though, how the shift of opioid use during the opioid crisis has moved away from prescription to more illicit forms of drugs. So fentanyl now is found on the streets in terms of it's often sold as powder. Sometimes it's sold as heroin, so drug users may not be aware of the exact drug that they're buying. This can be significant because heroin is an opioid, but it's not as strong as fentanyl. So if a drug user thinks they're buying a less powerful drug, it may lead to an accidental overdose. Another way that fentanyl is available is through the use of counterfeit pharmaceuticals. These are drugs that are designed to look like actual pharmaceutical medications. However, they are made illicitly and don't contain the drug that people think it does. The picture on this slide shows some green tablets that are designed to look like OxyContin tablets. OxyContin contains oxycodone, which is an opioid drug, but again, it's a drug that's not as powerful as fentanyl, and there has been a large number of overdoses and deaths that are occurred when people have been using these counterfeit pharmaceuticals, not realizing what drug they were taking. And then fentanyl analogues also being detected in forensic casework, and fentanyl analogues are chemical substances that are closely related to fentanyl. One of the most common fentanyl analogues that's seen in forensic casework in terms of overdose deaths is a drug called carfentanil. Carfentanil first appeared in kind of on the streets in Canada in around 2016. And this mirrors when it was first started to occur in the United States as well. Carfentanil is an opioid drug. It's approved for use in large animals. So some vets may use carfentanil, but it's never been approved for use in humans. It's an extremely potent opioid. So it's 100 times stronger than fentanyl and approximately 10,000 times stronger than morphine. So if you recall, fentanyl itself is an extremely potent drug, but now we're looking at a drug that is 100 times stronger than fentanyl. So another thing that's important in the opioid crisis is something called novel psychoactive substances. Now, the definition of that is that they legally mimic the effects of traditional drugs of abuse. So, for example, hallucinogens, stimulants, cannabinoids, or opioids. However, they're not internationally controlled. So legally, they can be described as being kind of in a gray area. They're sold kind of over the internet. But in terms of the opioid class of novel psychoactive substances, some of the issues occur with this is that these new substances, they can appear and then sometimes they can disappear rapidly. So in certain countries or certain geographical regions, maybe for a few months, you might detect this novel psychoactive opioid. It might cause overdoses, it might cause fatalities, and then a few months later, it seems to disappear and you don't see it again in casework. Other times, a new drug will appear and then it remains popular and you see it for more than a few months. So laboratories need to be able to adapt quickly. This can be hard because a lot of toxicology laboratories have limited resources. So sometimes you need to make decisions. Well, which drugs are more prevalent? Is this a potent, more toxic opioid? Is it something that we need to develop a method for rapidly? An example of that would be carfentanil, which I talked about earlier. So this research I was involved in with some of my colleagues from the Centre of Forensic Sciences in Ontario. And what this research looked at was to provide information on when carfentanil appeared in Canada, how did the laboratory respond to the appearance of carfentanil? So we looked at adding carfentanil to one of the common methods of analysis that we used. So we were able to start screening and quantitating carfentanil in all the routine death investigations. And that enabled us to help the death investigators and provide important information for public health too, to monitor this new dangerous drug and to see what trends were happening. And it's really important for forensic toxicologists to share the information they have with the scientific and also the medical community. One of the things from this study was that we looked at what other drugs were present in deaths where carfentanil was significant. We found that the most common co-occurring substance in carfentanil-related deaths was cocaine and or benzoylecgonine, which is a breakdown product of cocaine. We found the indications of cocaine use in 54% of cases. This is similar to other published research that also found stimulant use with carfentanil. So for example, a study from Florida showed that cocaine was the most frequently detected drug with carfentanil. And a study from Alberta in Canada showed that in that area, it was methamphetamine that was the most frequently detected drug in combination with carfentanil. And this type of information adds to the growing evidence about the potential fourth wave of the opioid crisis. If you recall earlier, I was talking about people now saying that opioid use, it seems to be now occurring more frequently with stimulant drugs. So this carfentanil information adds to this fourth wave. I did mention about the novel psychoactive substances and how they can appear and then sometimes disappear. So carfentanil, when it appeared in Canada, it's still a significant opioid. It's still seen in many death investigations. So it's frequently observed in many forensic cases. Other drugs, so for example, U47700 is a novel psychoactive opioid. It appeared around the same time as carfentanil in Canada and also in the US. Users apparently report that they get more euphoria taking U47700 compared to fentanyl. So it was one of the reasons why it was becoming popular. It was a drug that was developed by a pharmaceutical company way back in the 1970s, but it was never used in humans. So there was limited information about the toxicity of this substance. They did change the legal status in 2017. It became a Scheduled 1 controlled substance, and it hasn't been frequently detected in forensic casework in Canada in recent years. So this is one of those examples where it was useful to be able to detect this drug. However, the trend for this particular drug seems to be that the use has declined. In terms of sharing information with public health, the ability for forensic toxicology labs to add a new opioid to an analytical method can be very important. So it can provide important surveillance information for public health agencies. Sometimes timely data collection in an outbreak can have a significant impact in supporting public policy. It can allow kind of interventions, allow harm reduction to be put into place to try and reduce the dangerous overdoses or even deaths that occur following opioid use. Also, toxicology labs can help contribute to research, for example, about at-risk populations. An example of the role that forensic toxicology can play in this is drug alerts. So some organizations will work with toxicology laboratories to enable rapid drug testing of street drugs. An example of this would be in Toronto, their drug checking service. So this is something where drug users can actually send a small portion of their drug to a lab, and they will test it and let them know what is actually in the drug. It's quite common that people buying drugs illicitly, they may think that they're buying one substance. It might not be that substance, or it could be cut with other dangerous chemicals. So it's a way of reducing harm. For this drug checking service, all the results are monitored, and then alerts can be issued to the general public. So, for example, in the spring of 2021, the Toronto's drug checking service issued an alert to let potential drug users know that carfentanil was being detected in some drugs that were being sold as fentanyl. Because carfentanil is so much stronger than fentanyl, alerting users that the drugs that they were buying might actually be a lot stronger can sometimes help reduce the risk of overdose, because they're going to be more careful, hopefully, if they're consuming those drugs. So it plays an important part in harm reduction and can alert drug users about potential contaminants. These types of early warning systems, they don't just come from testing the illicit drug supply. You can get data from toxicology laboratories, information from overdoses, like hospitalizations, and you can alert law enforcement, you can alert public health, and it can be a crucial part in helping to deal with the opioid crisis. So an example could be, there could be a certain geographical area where a number of deaths occur over a short period of time, and some of the toxicological data that arises from that might be an indication that certain drugs are present in an area. So, for example, maybe carfentanil is present and it's being sold as either fentanyl or heroin. And if people are alerted to this, again, it may help prevent overdoses because they're aware that there's something more dangerous in the drug supply. Toxicology data is also important for general research into different areas of the opioid crisis. They can help look at drug trends, they can look at vulnerable populations. A couple of examples of that. This is an example of a study that was looking at opioid-related deaths in Ontario during the COVID-19 pandemic. So the toxicology data and death investigation data was looked at for the first 15 weeks of the pandemic, and it was found that there was a 38% increase in opioid-related deaths. Some of the trends that were seen with these deaths were that individuals were using drugs alone, outdoors, in hotels and motels. During this time, there was a lockdown in Ontario, and people were advised that they shouldn't leave their homes unless they had essential reasons for doing so. So there was the possibility that people were less likely to seek assistance with any drug problems they were having. So they didn't access treatment. They maybe had reduced support network. So, for example, people using drugs alone, if they do overdose, they don't have anybody to assist them. So this was some useful information that toxicology data helped contribute to. Some research that I've been involved in recently has been about opioid use in correctional facilities. So we know from previous research that inmates are particularly high risk for opioid overdoses in comparison to the general population. And so we wanted to look at drug-related deaths in the Ontario prison system to see, how has the opioid crisis impacted this vulnerable population? Did we see trends that mirrored the general population? And could some of this information be used for potential harm reduction measures? One of the things that we did see, so we looked at data from deaths that occurred over a 10-year period from 2009 to 2019, and it did mirror the general population in terms of seeing a significant increase in fentanyl-related deaths, which was expected. And again, it was useful information to provide kind of public health, people working in correctional facilities, and some information that's come out of research like this, and some inquests that have occurred into deaths that are occurred in these facilities, is to try and provide the use of naloxone kits in these facilities. Naloxone or Narcan is an antidote for opioid overdoses, and it can be extremely effective at saving lives, reducing overdose deaths. So having this kind of data from research into opioids that are seen during deaths can help. They can help change public policy. So just to conclude what I've been talking about, I think that it's important to note that in terms of the opioid crisis, collaboration, it's essential for helping to prevent overdose deaths and just general overdoses. The opioid crisis has been a significant health concern, and forensic toxicologists can help provide timely data and also some comprehensive surveillance information. And it's hoped that this can help inform efforts to prevent and respond to various opioid overdoses. So thank you very much for listening. If you have any questions, please feel free to contact me. You can use my email address, karen.woodall@utoronto.ca. I'd be happy to correspond and answer any questions that you have. So thank you for listening.